Yeah. No, now it's off. It's on?
On?
Okay.
On.
All right. Cool.
Okay.
Cool.
Jay, I'm in charge, okay?
All right.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum. This is Back at It with Dr. Decompression.
Okay, here we go. Welcome. This is the Back at It podcast with Dr. Decompression. First in office, guest appearance, we have Jay. I'm going to introduce Jay in a moment. I want to thank our sponsors. We have PillowWise USA, amazing pillows, for sponsoring the podcast. And then we have PowerPlate USA, which helps our patients that are struggling and recovering from disc injuries. So thank you to our sponsors. And we have Jay.
Hello.
Jay, welcome.
Hello.
So I guess we should just kind of get into it, Jay. Jay is a patient in the office, our first in-podcast, in-person live episode. Why don't we just get to it, Jay? Why don't you tell everyone, how long have you been coming to see myself in our clinic? How long?
I was just thinking about this. Has it been 2 years?
About a year and a half.
A year and a half.
I was
Okay.
checking your chart before we did
Okay.
this.
Good.
Year and a half.
All right.
Okay. And why'd you come see us?
I have this severe back pain caused by arthritis and what was the thing that dish, yeah. And it's to the point that I was not able to do anything physically. And the other very important factor that I didn't realize, but I realized after I came to this clinic, is that it changed my mood. The quality, the quality of life issue is really down the drain. And I was I am very happy that you helped me out a great deal. You pretty much, by removing the pain, you helped me restore my life.
Wow.
This is not a overstatement. This is true. I think most, if not all, of the other patients would probably say the same thing.
Yeah.
Because they come here with a severe problem, right?
Yeah, we don't see simple cases.
Yeah.
Right? We see very intense, complicated cases like yourself.
Yeah.
Walk me through. You said the mental state. Give me some examples of that. Like, what were specifics from a mental that you were struggling with?
Well, it's very simply the severe pain impacts your mood.
Yeah.
If it impacts your mood, it impacts your decision. It impacts your outlooks to life. It impacts your everything that's involved in it. Then the trajectory of your life is really downwards. And I didn't realize back then. Now that my problem has been removed by your practice, I can see that because I use the word trajectory is upwards of my life. Yeah. And that is, I think, is the most significant experience I can share with everybody. I mean, everybody knows this thing works, but what I'm talking about, what happened after this thing works.
Because sometimes it's the pain that brings you in. Sometimes it's you're in a bad mood, right?
Yeah.
You're not in a happy.
Everything's related to it. Start from that point,
exactly.
And then it impacts everything in your life, your decision-making process, your mood, the way you look at life, the way you look at your environment, the people you're dealing with. You become short-tempered or whatever.
Irritable.
Yeah.
And that's hard for someone that's not in pain to see. And if you're not in pain, it's hard to understand that, right?
Absolutely.
If you have the pain, you get it.
Absolutely.
Yeah.
Absolutely.
Yeah. Well, I'm glad that you're happier and that you're in a better place. Obviously, you're doing a lot better.
Believe me, I'm happy.
Wow. For our listeners, that may be new to decompression or new to our service, like, walk them through what were the services that you were getting. So you came in a year and a half ago, with back pain. What did we do with you? How do we get you to where you are now?
Well, I basically I came to this office because I saw an ad.
Okay.
Ad on TikTok, and this new approach to these type of people who has these type of problems. I said, the problem described here fits my situation. So I just went through a physical therapy session more than once, you know, it never really solved my problem. So I was getting a little bit frustrated and helpless at that, and discouraged at that point. And so I saw the ad and saying, hey, you know, I wanted to give it a shot, see what could happen, right? So I came to his office, I went through the process of consultation, and I decided to join the program. And you put me on this, well, you can describe it much better than I can.
No, here I hear you're doing great.
You put me on
You're
this computer bed, I call it computer
bed.
platform.
That's good.
Yeah, computer bed, and you basically is stretch is it, can I call it stretch the spine?
stretch the
Yeah,
spine.
it's stretch the spine, and
That's exactly what it does.
yeah, basically that alleviates the problem.
Mhm.
The pain is gone, and I can function normally now. My mood is getting better. The whole world looks better to me now.
lights are brighter,
The
right?
lights are brighter, yeah.
When you get that pain out of your brain and your body, you feel a lot better.
You're preoccupied. Everything is
Yeah.
about the pain.
100%.
Yes,
And how long did it take you on our, what'd you call it, computer bed?
computer bed.
I'm going to use that
Okay.
trademark. On the computer bed, how long did it take to start to feel better?
You know, I went through, I started twice a week
Yes.
as you prescribed. The first time of the first week, after that session, my pain got worse.
So after 1 week,
After the very first session,
time.
yeah, the
a
first,
little flare up, a little more intensity. of pain,
yeah.
right?
And then I got a little bit concerned. I'll talk to you, and
Yes.
then we decided to stay on the program. And strangely enough, from the second session on, the pain is gone.
Done.
Was gone.
The flare up pain, the pain that was there because of the
Well,
treatment, or the original pain that you were in for?
The original pain.
The original pain.
It's just it happens. I don't know how to describe it. Maybe you can describe it much better than I can. It's just, to me, as somebody on the receiving end,
Yeah.
it just happens just like that. It's just
Poof.
it's gone.
Yeah.
You know, it maybe I can explain it. Maybe once the pressure's off, then everything that's associated to that
Yes.
is gone.
Yeah. So what happens, and that's important because Jay, when I was meeting with you and with other patients,
Mhm.
there's over 100 things on these tables I can do.
Mhm.
Angles,
Mhm.
twisting, turning, the amount of pull. For you, based on your condition with dish, there were two main angles I wanted to do. And that's why we, when we tested you, we pull your leg,
Mhm.
we kind of tug you, we compress you, and we have an estimated, calculated, guess, clinical guess on what's going to be best. I went with number one. Number one, it flared you up.
Mhm.
But we went very light, so it might have flared you up and caused some discomfort, but it wasn't intolerable.
That's
Like
correct.
you could live, right? It wasn't like it
Right.
harmed you,
Yeah.
which is a concern. And then I think the biggest part of, we would make a mistake if we did the exact same treatment.
Mm.
If you said, hey, I'm not feeling great after the treatment, and I was to recreate that and go more and faster and harder at that same angle, that would not be a good idea.
Mhm.
So we made the modification based on your clinical experience, and we changed it to a different angle, and like that, you felt better. And what happens when we pull, we're relieving pressure. And the pressure
Okay.
on the joints and the discs, and that's affecting the nerves, and that's causing your pain. Some patients it happens in a week, and some it happens in 6 weeks. For you, it was like magic.
Just out of curiosity,
Yeah.
Most patients, how long does it take you to alleviate the pain for them? How many sessions usually?
Good question. In a way of, hey, the pain's getting better or the pain's gone.
Gone.
Gone could be 4 to 8 weeks to be
Okay.
gone.
Okay. Okay.
Usually it's a week to 2 to start to feel a change.
Okay.
And how long did you have the condition before you came in?
Oh my God, years.
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 So in 1 week, you went from, with us, years of pain. The first session was a little bit more intense.
Mhm.
And then after the second session, you felt great.
Yeah. Yeah. So I don't know. This is really magical. I don't know.
Magical's a common
Magical
word we
is
get
common
these
word.
days.
Is that right?
Yeah.
So I guess, one message I'd like to give is it worked for me. It really worked for me. It improved my life, as I was never imagined I could.
Yeah.
Yeah. So,
Wow.
yeah. And I work better now. My mood is better. The people around me see me as a happier person. Everything changed. Everything is like a chain reaction.
The whole aspect of your life changed.
Right,
not
right.
just
This,
the pain.
yeah.
Yeah.
But because the pain is gone, so everything associated and derived from the pain
Yeah.
is gone too.
Wow.
So that is something I really need to drive home to people who is watching this.
And that's for you or for anyone else that's maybe a spouse or
it's
someone
that-
else, like, hey, they see someone that's,
yeah,
you
yeah,
know,
yeah.
their mood's different, their
Yeah.
eyes aren't there.
No, right. Exactly. So
Yeah.
this is something I'd like to, because I guess a lot of people talking about their success after you receiving treatment, but I think it's more important to let people know what will happen after the success, and
Absolutely.
how it's going to change your life, how your life is going to improve from that point on. And I think it's important. It's very important.
Looking at the future with how you can exercise, how you can work, how you can play with your granddaughter that came in the office the other day. All these things,
Yes.
right?
Yeah.
And on the other side, Jay, if let's say you did the physical therapy, it wasn't working.
Hmm.
If you didn't find us, if you didn't respond to our ad online and look at us and give us a chance, we didn't get a chance. What would you have done?
I don't know. I probably keep looking. I would just keep looking for a solution. Not even know there is or there will be a solution.
Yeah.
Yeah. So that's
Hard to say.
yeah.
Yeah.
It's really hard to say. But one thing for sure is like I say, it's a downhill trajectory.
Yeah.
Yeah.
And then now what are you doing? You come in how often?
Once a week.
Once a week.
It was twice a week.
Yeah.
Now it's, thanks to your session and therapy, now I'm reduced to once a week. Now I'm in the maintenance mode. Should I call it
Maintenance,
maintenance?
supportive,
Supportive
mode, yeah.
maintenance
Yeah.
mode. So I'm good.
They're good.
I'm good.
And you've had there's been some bumps along the way.
Yeah.
Right?
Yeah. I actually had two hurdles. The first hurdle is got me into your office. The second hurdle is I began to develop sciatica.
Yes.
That lead to another level of pain, which is very painful.
That was way different than what you originally
Yeah,
came in for.
exactly.
Yeah.
Exactly. And then your computer bed helped me again. And now that problem is gone.
And did we do anything different on the tables?
I don't know. You tell me.
Yeah.
Yeah.
So, you had one condition that you came in for, the dish, and that dish, which we'll discuss, that caused some inflammation in other areas based on your spine, and it led to inflammation of the sciatic nerve down your leg. So I made modifications to the table, the computer bed, what we did, and instead of pulling you and oscillating back and forth halfway,
Mhm.
we pulled 80%. So we went like this. So think of an accordion. The table works like an accordion. It goes out and in, and I can dictate how far out it goes in,
Mhm.
how far out, and then how much it goes in. So the amplitude.
Okay.
This was working really great for you.
Okay.
When you had the flare up, we did the same. It wasn't working. Like, it was working,
It was.
but not great.
It
were still
was.
struggling at a slow pace.
Right. Yeah.
Right?
Yeah.
So then I changed the amplitude to go like this,
Hmm. Oh, okay.
and that kind of tricked your body,
Okay.
and that is what got you over the sciatica.
Oh, okay.
So we can use the tables, the computer beds, in a way that the amount of pull, how much back and forth, the angle we pull you, that kind of thing. And those are all the factors that we determine. That's how we got you over the hump.
Mm. So basically, it's not a set formula, so to speak, but it's really based on your experience and how you handle different situation in a different kind of way, right?
100%. What I did with you,
Hmm.
I've done the angle like that, but that I've never done a treatment the exact same way just for you.
Oh,
I'll use my clinical experience. Jay, we just counted.
uh-huh.
I've done over 10,000 decompression sessions.
Wow. Okay.
So I kind of know what to pull you, how much, if it's not working, what the next step should be, or no different than your first session. When you had more pain,
Hmm.
I knew how to switch it so we could trigger a different response in your body.
Okay.
And that's where the experience comes in.
Well,
That's why you came and saw it.
and 10,000 you mentioned?
10,000
Wow,
plus.
that's quite an experience.
That's a lot.
Yeah.
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 So now that you're here, you're doing great. What activities do you do outside of the office?
Not as much as I wish. I go to the club now. I exercise. I gave myself a goal like twice a week. Probably average once a week.
Okay.
Yeah, I'm still kind of lazy guy. That's the bottom line.
That's good.
Yeah,
We're gonna get to two.
yeah, and I continue to do my work, um, which is something I really love to do.
Can you tell us what you're doing?
Oh, I'm in broadcast.
Okay.
I'm a old school broadcaster, start from old radio to TV, and then now just like you is our internet.
It's all internet now.
It's our internet, man. So now it's AI, right? So
It's getting there, as
I'm
we talked about.
yeah, I'm trying
Yeah.
to catch up, man. I'm trying to catch up. I have a lot to learn from you.
We'll learn from each other.
So I'm happy. I can't complain.
Good. Good.
Thanks to Dr. Dudum.
Thank you, Jay.
Yeah.
That means a lot. You've been here for a year and a half
Yes, sir.
and you're doing amazing,
Thank you very much.
right?
Yeah.
I want to touch on your condition, DISH. I forgot to mention it.
Okay.
It's called diffuse idiopathic skeletal hypertrophy. It's a fancy name. It means that instead of the bones in between the spine, the discs,
Hmm.
there's not much arthritis, but the ligaments on the front and back, they calcify and they get brittle. So that's why you have a lot of stiffness.
Stiffness. Yeah.
That's why leaning forward, getting up from a chair, getting out of bed, you lack the flexibility in the
Yeah.
spine
You can.
because the ligaments that are supposed to be flexible and stabilize it are very brittle and rough. And that's what your condition is.
Yeah.
So it's an inflammatory arthritic condition. Knowing that was important to change the angle of the table. So knowing what you have and how to adapt to it was key.
Mm.
That's why we give you stretch to do. Exercising is great. Walking is really good to do.
Okay.
Anti-inflammatory diet, those types of things.
Okay. Yeah. The other thing is talk about stiffness. You notice that my neck is stiff too.
Yes.
That's really from the surgery, from the spine surgery, which is also similar condition, but
Similar condition.
in the upper
It
part.
happens in the top and the bottom.
Right. The top part.
Yes. So the cervical spine, you had that condition. When did you have the surgery?
Oh, this is looking back almost like 20 years now.
20 years ago.
Yeah.
And were you suffering from similar symptoms as the lower back pain?
I felt, and because of the condition
Yeah.
associated to that, and after I felt, I was paralyzed from the neck down.
Wow.
So I have to go through a surgery.
You had to.
Yeah, I had to go through a surgery. So, long story short, long but still effective recovery. I have two pins on each side, so that kind of limit.
And you have a scar there, but
Yeah.
you had an injury, you had the condition, you needed the surgery.
Yeah,
There was no
yeah,
other-
I have no other
there's-
choice.
No.
Because otherwise I was paralyzed from the neck down.
And that would be something that we can't do spinal decompression on.
Yeah,
So knowing that is important.
So I went through a lot, but
Yeah,
I'm glad I'm doing okay.
you're doing great.
Yeah, I'm doing okay.
From where you were a year and a half ago?
I'm doing great.
Yeah,
Yeah, I can't complain.
you're doing very
Right?
good.
Yeah.
And you've had a great experience in the office. We love having you in the office and being part of your journey.
One other
Okay.
thing, so I don't know, should I bring it up or not, is your office staff is incredible.
Thank you.
And whatever you did a good job, either in hiring or training.
It's both. The people are great.
Yeah,
And so the important thing is hiring great people that are empathetic and that care and that want to help people.
Mhm.
And then creating a good environment. Because most people, when you first came in, you talked about mood. If you're in chronic pain or you're in severe pain.
Yeah.
The amazing thing is to see the patient come in that's in a lot of pain.
mhm.
That sometimes when you're in a lot of pain, you're not very nice. Happens. Right.
Yeah, it's understandable.
to transform that patient where they come in not maybe the best mood to weeks and months later to see that they're like the happiest person in the world. When you walk in, don't take this personally, Jay, you're happier than you were, when you first came in. And it's
That's
amazing
the-
the staff thrives on being part of that process.
Yeah,
And that's
they're so happy to see it. I'm doing good. I'm doing well.
yeah.
Yeah.
It's like when you had the sciatica, you came in with a cane
Yeah,
because it was hard to walk.
right.
When you came in and everyone, all the staff, all the members are like, where's your cane, Jay? Where's the cane? Is it under the table? You didn't need a cane anymore.
Yeah. I forgot about it.
You forgot.
Yeah.
And that's a common thing that happens every week in our office, and it's important to appreciate those milestones for the patients too.
That's
Yeah,
true.
thank
That's
you for
true.
saying that.
Yeah.
What should someone do, Jay, if they see an ad on TikTok or something, they see our information, what should you tell them to do? What would you recommend they do?
I think at least you should give it a shot. I mean, this is something, at least it was for me, it was something new. I never heard
Yeah.
about this before, so I can understand people who has reservation or, but I mean, just give it a shot. I mean, what's the worst that can
What's the worst that can
worst
happen?
that can happen, right?
And I guess a common fear is, does it work? So what would you say to someone that says, hey, it doesn't work? It's not going to work, like a medical doctor or someone online or a friend, it doesn't work. What would you tell them?
It worked for me. It worked for me, and it worked for another family member, which
Okay.
who I'm talking
Yeah, I
about.
do.
It worked. It worked for her too. So that's all I can say.
Yeah, that's
Right.
2 for 2.
Yeah, 2 for
It
2.
worked.
Yeah,
Okay.
yeah. And plus, this guy said he had treated more than 10,000 people. So you decide.
I'll let you say that. Anything else, Jay?
That's it. I appreciate you letting me give me the opportunity to say my piece.
Thank you. And I greatly appreciate what you said and being our first guest and just sharing your story. But, myself and the whole team, most importantly, we're excited about just how much better you feel.
I'm glad
Most
to.
important.
Appreciate it.
Thank you.
Thank you.
I want to thank Jay for jumping on the podcast. Episode 17, first guest. Thank you to our sponsors, PillowWise and PowerPlate. Stay tuned. Don't forget to subscribe for episode 18 coming soon. Thank you. Thanks, Jay.
See ya. Cool, man.
Thanks, Jay.